We begin, though, in Yukon, where a new COVID-19 outbreak has been declared in its capital, Whitehorse. It comes on the same day Ottawa announced that territories will have enough vaccines to fully immunize everyone eligible by the end of this week. Sandy Silver is the Premier of Yukon. He's in Dawson City. Premier, welcome back to the show.
Thanks, David. Thanks for having me.
Your Chief Medical Officer of Health declared a COVID-19 outbreak in Whitehorse. How concerned are you about that situation right now?
I mean, we're always concerned about the health and safety of Yukoners. We've done a fantastic job about traceability. So understanding how the virus is traveling in Yukon is something that I give all credit to the Department of Health and Social Services. They do a fantastic job of tracing. Interesting to note, there was a case, in Dawson City as well. That person is hopefully getting better. But if anything, David, this is a cautionary tale of vaccinations. If you get vaccinated, your situation is a lot better than if you don't. We have hit 80% of eligible Yukoners have now received their first vaccine. Over 71% have received their second vaccine, and we're working on the youth vaccinations right now. We're hearing anecdotal information about, the folks that do get the vaccine, and if you do get symptoms, they're not as bad as those who don't get vaccinated. So we're taking these things very seriously, these cases very seriously, but we believe that we're in a very good place right now. Our Chief Medical Officer has said before, and I'm sure it's being said right across country, this is about going from pandemic to endemic to living with this disease. And how well do we do that? Well, that depends on how well we get vaccinated.
I wanted to pick up on that point because I think the government said yesterday that out of the 13 cases in this outbreak, 12 of them were people who were not fully vaccinated. And the numbers you listed off, I think 80%, they're higher than they are on the national average. But what's it going to take for you to close the gap on the remainder of this?
When we announced that we are opening up our internal borders to the rest of Canada to folks that are vaccinated, you don't have to self-isolate. If you come in, then if you're not vaccinated, then you do have to self-isolate it. And same with Yukoners. If you want to travel out and come back, we saw the rates of vaccination go up. Anecdotal information also of, those who get the virus while vaccinated, their symptoms are much less. They do much better. And folks that are not vaccinated, we had to medevac somebody out to Vancouver as well. So hopefully this helps. But really, David, it comes down to sharing that information and basically giving credit where credit's due for those organizations and agencies that are helping government to do so. And I'll do that with the Yukon Aboriginal Women's Council. This week, they just announced that they're a finalist in the Public Health Agency of Canada's Vaccination Community Initiative Challenge. So they received $25,000 just for being on the short list. With their project called Protecting Yukon's Health. The project was designed to build trust in relationships with Indigenous women, gender diverse people, and providing cultural reassurance about taking the vaccine. These testimonials of Indigenous elders right across the communities in Yukon, it's a fantastic initiative. It's this type of information sharing that really helps us in the Yukon. Look back a year ago, David, the misinformation that we've had, and together as leaders in the communities, and again with the Aboriginal Women's Group, Yukon Aboriginal Women's Group, it's this type of leadership that's putting the Yukon where we are.
So you've got the leadership. Ottawa says that by the end of this week you should have the supply, that they will deliver enough vaccines to all of the territories that you can finish the job. When do you think you're going to have this done? Have you got a date in mind where you think you can finish the vaccination effort entirely in Yukon?
It's a really good question. I'm in Dawson right now, my riding of Klondike, and we have the youth clinic here. We had one in Teslin as well. The one in Whitehorse is going very well, so we're starting to see the youth pick up in that vaccination as well. There's going to be a few areas where we're going to have to, take a look again if those rates are lower. I mean, it's so hard to predict. Again, as we start to see opening up, we start to see folks going to hockey games. We start seeing the rest of the world getting back to normal. It does pose the question to those individuals who are a little bit more hesitant as to why they were hesitant, making sure that they get onto our websites, getting the most up-to-date information, and just educating themselves on the need to get back to whatever sense of normal we can get back to. And so I think it's all about that communication. It's a national pursuit as well. As we as we continue on the Council of the Federation and the First Minister's meetings, this is where the conversation naturally goes to. I've been calling for a national registry of vaccinations to help facilitate travel with inside Canada. And I think that those continuing conversations are going to also see an increase in those who are willing to get vaccinated.
So you still have to do a bit of arm twisting before you can do some arm jabbing to get this thing done, I guess. So I just wonder, as you get near the finish line, I mean, how does it feel to be maybe the first or one of the first to get to the point of full vaccination in Canada?
It's profound. We had Dr. Teresa Tam saying that Yukon is a model that we should be all looking towards. Those are high accolades from our top doctors, but it also is a profound responsibility as well. And we really feel like we're a place that you can look to. Whatever herd immunity is as far as percentages, our goal is to get as many people vaccinated as possible. Our most elderly folks are in the 92 percentile for their shots, which for their first shot, and 89% for their second shot. So as we see the epidemiological trends continue, this is really important that we showcase our ability to move. And, I'm looking forward to the time. I have a sister in Boston. I have family back in Nova Scotia. I'd love to get a hug from all of those folks. So we're definitely looking at what the federal government is doing with borders. We just listened to the mayor of Skagway, Alaska, which is right beside Whitehorse, friends and family connections there. They're starting to open up with cruise ships. Their first cruise ship came into Skagway today. So things are starting to happen. Things are starting to work. We've always followed the advice of science. We've never put any political pressure on our medical doctors, and it seems to be working really well for us to follow the science. And now that we're seeing, folks starting to move and jurisdictions starting to get back to normal, I hope to see those people that are hesitant to stand up and to get their shots. But it's pretty profound to be living in the Yukon right now.
Okay, Premier Sandy Silver, thank you for your time and good luck with the rest of it.
Hey, thanks a lot, David. Appreciate it.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.